Hello, everyone. Welcome to Doctor's Health Talk Show. My name is Dr. Farhan Tahir. I'm joining you from Philadelphia. Today, it is my privilege and honor to invite one of my colleagues, my friend, Dr. Arturo Bonilla. Uh, Arturo, welcome. How are you?
Good. Thank you so much. Thank you for having me in this talk and looking forward to have a very enlightened conversation.
Sure. I want to for my audience, I want to tell them that you're vice chairman of the Department of Medical Oncology and Enterprise Medical Director of Research at Cancer Treatment Centers of America. And I have the privilege to work with you for almost last 4 years. And Arturo, you have one of those enterprising personalities, but still a smile on your face that is, uh, you know, never fades away. So I want to talk to you today about your life journey, and you have achieved, great accomplishments. But there is some secret behind that I would like physicians, fellows who are watching this show to get into that secret of success that you have made possible for yourself, and I'm sure it will inspire many others. With that very informal introduction, I would like to start about your personal life. So you grew up in Colombia, is that correct?
Yes, born and raised in Colombia, as you know. A lot of folks is like Colombia, Maryland, or something like that, or South Carolina. I'm like, no, actually, it's Colombia, South America.
Colombia, South America, yeah. And so you actually are a graduate of a medical school there. So one of my questions that I ask my friends is, how did you decide to become a physician? So tell us a little bit about it.
Yeah, so my journey to become a physician was a very personal one, and it came from actually my family. So, as you know, in Colombia, we are big families, and from my mom's side, they were, 9 children of my grandfather, my grandparents on that end, and I was very close to my late grandfather from my mom's side, and he had a bunch of health issues, but they were non related. Like all of them were very preventable. Like he suffered from obesity, hypertension, and gout, which are very close to what you do on a daily basis on the
Mm.
rheumatology side. Um, and I realized very young that there was no doctor in the family. Like everyone who had gone in through, all of them became professionals, even though my grandparents from my mom's side, they met when they were very young, and they raised a family. He was in the Navy, and so they moved around Colombia, uh, and all of them became in finances or public administration. He really made his really hardworking individual to raise 9 kids and get them all into college with very humble upbringing. So I said, well, there's no family doctor at all, and I'm seeing all these issues happening with ailments, and he was very afraid of going to the doctor. So, and I couldn't explain why. I was like, why are you afraid to go to the doctor? He's like, no, I don't know. I don't like needles. And this, when you are like, 12, 14 years old, I mean, you're like, you brush them off. You're like, whatever. Um, yeah. So, but then things got a little more complicated. So he ended up having end stage renal disease. And he went into dialysis. So I got exposed to the medical world very early because of that. And I just became curious, and it's like, okay, I don't want this to happen to anyone else in my family. I want to make sure that if anyone has an issue, at least I know what to do, how to guide them. And I think also became kind of the baseline for me to go into internal medicine in the future, and being a doctor for adults, because that kind of framed my mindset. So um, I decided to go into medical school. I was in between engineering or medical school. I really like, math, but also like chemistry. And in Colombia, you start very young into anything you want to pursue. So you're like 16 or 15 when you apply for any college, which is crazy because you don't even know what you want for breakfast. How you want to know what you're going to do for the rest of life, right? So, um, but I set my mind, I want to be a physician. I want to be the first one in my family, and let's see how it goes. My school, I didn't know how hard it was to get into until later, until I actually made it. So my dad, he said, okay, try your best. I know medical school is hard to get into, so we'll try whatever we can. And the one that I really wanted to go to, which I ended up going to, which is the public university, the National University of Columbia. It's a nationally ranked exam. There's no like personality test or anything. It's just if you make it in the top 100 of that application period, then you make it. If that's the top 100 scores for the whole country. And I had no idea about that. I just simply went to it, and my grandfather was very sick at the time, and he said, I believe in you. You're gonna be fine. I trust you. You're very smart, and you work hard to make this happen. So just do your best. And I really took that advice close to my heart, and I took the test. I had no idea how it was going to be until the results come actually in the newspaper, in the national newspaper. They get published and their numbers. And you find if you actually made it, it will show up in a list of 2,000 or 4,000 numbers there. And I remember that A400,206. That was my number. And it was called. I was information. I was in a all male Catholic school at a time, and they just put it in formation like the military, right? And then someone was reading out the numbers for everyone to read, and then they say, "Hey, Arturo, you made it into medical school." I'm like, "What? Congratulations!" And that's how I found out. It was crazy, and I had no idea. Interestingly enough, after I made it and they found out, they extended me from all the rest of the tests for the rest of the year, and I just graduated. So.
Very inspiring story. Now, was it in the same city that you were living, or you had to relocate and live in a boarding house or apartment? Or something?
So I was lucky enough that it was still in Bogota. That's what I was all my life. So I didn't have to move. But a lot of my friends and colleagues that I hold dearly now, because they're from the same time, they came from all over the country. So it was a great experience to me, because I was able to get exposed to a bunch of very, very smart, very different backgrounds individuals. So I think that also helped me a lot.
So is it 4 years of medical school there, or 5 years? Because it seems like you started in 99, right, and graduated in 2004. So it's 5 years.
Right. So it's a total of 6 years. So they put it all together. It's an extremely intensive thing. So you start at 7 a.m. until almost like 6 p.m. classes nonstop. And it's about 5 months every semester. So it's a very challenging, and I think because we're young, we just go with it. But I go back and that's pretty grueling. Yeah. So
Yeah. So so Arturo, that is a great story about you wanted to help your families, and I'm sure they're very proud of you. Now, in our conversations, I've talked about you're still very close to your family. Your grandparents still come and visit you. Is that true?
yes.
You
Well,
know,
not with
and
COVID, but
not these days, but like until last year when we were, or maybe 6 months ago, we were sitting on a lunch, and you're like, they like coming. So this is great. You've kept your connections. Now, when did you come to the United States? And I guess you started as John Hopkins research fellow.
yeah. So that was my first encounter in the U.S. was 2004. Right after graduation, I decided to come here just to learn how the system was, because I had no idea. All my education was in Spanish, and I really had not taken formal English classes. Everything was just by whatever I learned in the high school. And during medical school, I bought the books in English because they were cheaper and they were up to date. So that's what I did on top of my things, just to learn the medical English. But I went to University of Miami 2004 just for getting to know the system. I did an observership, got some letters of recommendation, and then I needed to do my social service in Colombia, which is how you get your license. So I worked as a general physician, saving money. I had took 3 jobs, so it was very intense. I was working in ICU, an ER, and an internal medicine floor as a hospitalist, and taking the test. So as you know, you had to take the USMLE test and get ECFMG certified and all that, so you can be equivalent to a United States medical student. So I tried to do everything. I crunched it all in a single year. Actually, in 9 months, I was able to take the 3 tests. And
Wow, that's
and
intense because I took 2 years.
yeah, and it started backwards. I did the step 2 CS first with patients, and then I did a step 1, and then did a step 2 CK. Um, and it was interesting because, I was naive. I came by, and I had not taken my final step, the step 2 CK, and I was applying for residency. And I said, well, they asked me, what is your step 2 CK? And I was like, I don't know. I think medical students here don't need it, so I just applied thinking that was fine. It's like, no, you're an international medical graduate. You don't have that. Why you apply? You're lost. So I had to stop everything, my observership. I studied like the books like for 12 days straight, flew back to Colombia, took the test, I came back. That's how much preparation to the CK. I crammed
Yeah.
everything up. But I guess, I mean, I don't know, it went pretty well. Actually, it was my best score. So that was
You know,
interesting.
and I know really good some smart physicians who could not pass that test on first attempt because it was a cultural shock and language barrier, and they couldn't just understand what the patients were saying. So that's really tricky. So that's interesting. Now, any unforgettable moment of Columbia Medical School or work there that you can still remember, a patient you took care of?
Well, I think when folks here in the U.S. want to volunteer, going to, Haiti for an earthquake or something like that, I always think about it as that, well, I think already was there because when I was in medical school, it's pretty much, you go ahead and do what you can to help these patients because they're, underinsured. So I remember, like helping out, doing like chest tubes and driving patients around everywhere and becoming really good friends with them, which it was a very interesting experience to me because you don't get that chance to be so close to your patients and understand them as a whole individual in a different scenario. So to me, that was very enriching, and helping patients from like when they come through the ER door to go up and take them to participate in the OR procedure and then following them up. It was like a full residency while I was in medical school. And I think that gave us a lot of grit. That's like you have to learn things. No one like gives you like spoon feeding on you. You have to own that patient responsibility from the beginning, and that gives us a lot of character and I think frame the way I wanted to take care of my patients, which is like end to end, and try to understand where they were coming from. So that's something that really struck me as as an interesting thing. And making stuff up in terms of like, oh, I don't have a chest tube, so let's try to. I remember I had one day in the ER, I had to actually do the thing with the like a pen to, in the meantime, to help the patient while they were getting a chest tube,
Yeah.
which is
So
crazy to me.
lot of countries, like I grew up in Pakistan, and when I was doing my house job, we used to call it, I had to do similar things. And as you explaining, the connection that you develop for that time being, that you are doing something with the patient and they are with you, you're building some personal relationships. Because eventually we all who become physician, part of us has a longing to actually serve the patients or connect with them as human beings. So it seems like you enjoyed that part too. So that leads me to the next question. So you had about 3 years experience as a physician working in Colombia, and then you came here. You worked with in an internal medicine program where you kind of stumbled upon a mentor that actually then defined your life as an oncologist. So tell me a little bit about that.
Yeah, so I had two mentors. One that Dr. William Eschler, he was the deputy director for the National Institute on Aging for the NIH. He was very passionate about learning about changes that happen with aging and the hematological side. So I was really interested in what he was trying to offer me, and he really opened the door for me to really work with him on a few projects. The other mentor I had was Steve Gore. He is well, now he's at the NIH, and just recently retired from Yale Medical School, but he was at Hopkins at the time, working in epigenetics for leukemias and MDS. And um, I met him by random chance. I mean, that's one of the things that, when you expand your field and go different directions, you may stumble upon folks that are equally as impressive and helpful, and you don't even know what's going to take you to it. So as you may know, I always like to sing. I mean, just very randomly. So I wanted to get an outlet beyond doing stuff at work as an intern and a resident. So I decided to join, or at least audition for, the Handel Choir of Baltimore, which is this, Baroque singing group that is probably the longest Baroque singing group in the United States. And I joined as a tenor.
Mm.
And it was great because I just went a couple of days a week, and it was relaxing, and I met a bunch of different people from Baltimore and from different backgrounds, and I made some good friends there. And one of the bass singers was Steve Gore. He's like, "Oh, so you're internal medicine resident." And he's like, "Yes." And how about you? "No, I'm attending at Hopkins." He's like, "Well, I'm also going there for research and stuff. So where do you work?" And it's like, "Hematology." I was like, "Really?" And he said, "Well, we both love singing. We both love hematology. Let's try to get something together." And he really liked the way I worked, and he mentored me for about 2.5 years when I was there. So I got the postdoctoral fellowship working with him, and we published. Actually, I was able to publish in Hematologica, which is the second most well journal in hematology, which was a dream to me, and really pushed me towards my fellowship that happened at the time. So that's the story on that, and I can mention something more interesting, which is I have a half brother, and he recently passed away about 1.5 years ago from leukemia.
Oh,
So
yeah.
but he got just diagnosed at the time, and of course immediately it just connected. I'm working in leukemia, doing all this. I need to help my brother as much as possible. So of course that even further my interest, and he was into remission for a long period of time, but of course these things happen.
Yeah.
But then another thing to push me to help patients, because now it became even more personal. So I ended up going to University of Miami for my fellowship, which is also close to home. I can go fly back and forth, and it was a great experience because I was also being able to help a bunch of patients who were underrepresented minorities, and I could also talk to them in Spanish if I wanted to. So it was a really enriching experience for me as well.
I know that one of the passions that you have is medical aspect of your life as a physician, connecting with people, and most patients that we share together love you. But you also became a kind of an emerging scholar in science and research, and then you went on to continue that journey. How did research become such a big part of your life as a professional?
Yeah, so research was the main reason I wanted to come to the United States. So there's wonderful programs in Colombia for training. I actually had a scholarship because in Colombia you had to pay for your residency. But I was able to get, because of my medical school performance, to get a scholarship. So I was ready to start there. But I realized that if I wanted to advance science, if I wanted to help more folks, if I could, the only way to do it was to go to a place where I have plenty of resources, and the United States was the perfect place for me to pursue that. So I was always trying to do something innovative, something different. My mind never gets settled. Like I'm always looking into something interesting, new, and I don't like repetition. So if I can, of course, every patient is certain repetition, but that's why I don't become a surgeon. A surgeon is an expert in their art and craft. Their ability comes by doing a procedure in a perfect way.
Yeah.
And I admire that 100%. But on my intellectual challenge situation, I always want something different. I want to learn something new. And being in oncology and doing research really kind of fit 100% on those goals in my mind. So so it is really one of those things when I'm trying to learn something new, maybe advancing science, getting new drugs, new treatments, new developments for my patients, and keeps my mind extremely entertained. So always intellectually challenged, and that makes me, fulfill professionally, and that's why I like it as well.
So then you took, you were at Miami, and then you took a position of assistant professor of gastroenterology, gastrointestinal oncology at UPenn, and you were there for almost 4.5 years. So what did you do there? You focused a lot on GI oncology and published and did some research.
Right. So I joined as faculty, and I was extremely excited. Penn is a great place, and you make the goal of the academics, so you just check those boxes and say you made it. So I was extremely excited to go there, and I met wonderful individuals at I was at Penn. Had a chance to train in the medical school. All these medical students coming. And of course, I focused my interest further into genomics, biomarkers, and clinical trials. But I also found a niche in medical education. So I realized that despite the fact that we have to teach every single individual about their, disease types and things that they have to do, and not only that, but also residents, fellows, medical students, and our colleagues, no one teaches us how to teach or how to be a very good communicator in that end. So that's what I decided to join the master's program there, and I pursued a 2-year program in master's in medical education. So that was another part of me that really was bolstered by doing that. And I also like the fact that I was able to interact with a bunch of faculty. When you're talking about Penn, is this behemoth big hospital where you don't know anyone, even in your own department. They don't talk to each other. Like everyone is like on their own spot, seeing patients, and like a running situation, and they're also competing interests. By being in a training program with those highly accomplished individuals, really helped me to connect with them and also feel a bigger sense of community that you otherwise don't get when you're just practicing. So I like that.
And I think that's exactly the reason we are connecting at this level, because we get to know each other. So it's a conversation and communication among physicians brings us together and learn from each other. You have also worked in companies, or you've been an advisor outside just a faculty. I'm looking at it. You have worked at several companies as an advisor. Maybe I'm gonna look at Philips, one of the companies you worked as an health entrepreneur, digital health, and many other companies. So tell us a little bit about your work outside as a clinician, and how do you help them grow and do things from a physician perspective?
Yeah, so I think that kind of fits on the same discussion we had about how I like to expand my horizons always. So I learned that by taking different opportunities and whatever life brings you, you're going to learn a lot from those things. So I took that advice to the heart from the beginning. So and it came actually from when I was a resident. I joined the American Medical Association, and they have all these different opportunities and expansion. So that was kind of the primer for that. Once I became faculty at Penn, of course, they see that position as a position of prestige. So they reach out to you for consulting. I started with just regular ad boards and whatnot. But then over time, I realized that I was really excited about doing things on digital health side, because there was really nothing there. And I thought it was the future beyond oncology practice. In oncology, immunotherapy and targeted therapies and researchers is the way to go. But the integration of that, it was hard to accomplish. And I found research was one of those things that was really hard to put together between community and academics. They don't talk to each other. So I wanted to find a way to bolster that process. So actually, I co-founded a company at that time called MSEd Bio, which is still running, and the goal of that was to really bridge that gap in clinical research. So as part of that, I started joining these accelerator, startup accelerator companies or institutes. And Philips HealthWorks had the incubator. So they call incubator startups, and they just basically bring all these companies from across the world that are really focused on a single thing, and help us grow and learn how to advance science from a really, entrepreneurial perspective. So that continues to be one of my passions, and I'm happy to report that those advisory positions have been very successful in helping to advance certain things. Right now I'm in the clinical board of Bright Insights, which just got a Series B funding of 40 million. Massive Bio continues to grow, and actually is joining a research effort with other companies. And I just recently joined Vidence, which is the CTCA DNA or data and analytics company. It's a startup, but it's a pretty well-established company from the founders of CTCA. And I'm currently the senior medical director. So I'm very excited to keep expanding my horizons and use my current relevant expertise as a practicing clinician. So things don't happen in a vacuum or in a PowerPoint, but actually anything that we do is by clinicians and patients for also clinicians and patients. So it's not just a technology company, but it's really focused on the needs in front of us.
So what I'm seeing is the uniqueness about you is, number one, of course, you are a physician and an oncologist, and then you have found your niche in gastroenterology, but you have gone from that to explore personal genomics, precision medicine, and digital health. And now you are unique in that way that you're putting everything together and come up with solutions that help us as physicians deliver the care, best possible care. My question for you is, you mentioned a little bit about Vidence, and when I heard this, I was like, it sounds like evidence. So maybe is that something that explains the name, or what is it? Could you explain a little bit more on that?
Yeah, so it comes from, like things that you can see, and how can you put them together. So the purpose of, or one of the missions, of course, there's a number of initiatives that we're following, but is looking at the best available evidence and democratize it, help to bring all the stakeholders together and really advance, genomics, real world data and analytics using this artificial intelligence platform called Simon. The purpose of this is to create a collaborative consortium where like Vidence is helping funnel all these different stakeholders from across the macro environment in health, including patients, all the data sources structured together, industry that they want to advance science with those patients, and also institutions beyond CTCA and others. We want to all of them, join the efforts so we can put all this information together and structure in a very meaningful way so everyone gets a piece of the pie. So it's kind of like that concept of community bringing everything together, but we need a powerful tool and platform to accomplish that. And that's what we're trying to do by really making it relevant and making it very effective. So more to follow. Is a very exciting endeavor, and you'll hear more from us.
I have to say that I have always been waiting for a moment in medicine where we can say that, okay, IT had maybe 20, 40, 30 years ago, entrepreneurs who changed how IT works, like, Bill Gates and Steve Jobs and Elon Musk. So I see the energy and the growth and the direction that you're going, that maybe you'll be able to bring the digital health and future of medicine for us, especially in oncology, for our patients and for the enterprise. And I'm really proud of what you have achieved already in a short span of time. I mean, really, 4 years, and you have already done so much in this institution. My question is, I can see the passion, the love, the happiness that you have. Is this the force of nature has brought you into this? Is that your dream job? Is that what you really wanted to do? Are you happy with how things are going?
Yeah, I mean, of course, there's always challenges that happen in life and things that we can't overcome. But I always focus on things that I can control. There's many things in the world that there's nothing that we can do about, and we're fine with that. I accept that as a whole. And I think cancer patients really bring that, in front of us every day. So um, eh, I think my problems and things that happen to me are nothing compared to what our cancer patients deal on a daily basis with the reality of having cancer. So I always come that to those senses is like, hey, perspective, right? So um, focus on what you can control, try to do the best you can with what you have available, and plan ahead accordingly for multiple scenarios. So um, in terms of my professional life, I think it's going in the direction that I wanted it to be. The idea is, of course, there's always room for growth professionally, personally, as an individual, as a human being. But as of now, I think that things are going, in a decent way. So if I go back to where I came from and where I am right now, I can say I'm proud of what I have accomplished, and hopefully I can accomplish more than that. From a young kid who was just middle class, nothing. There was no privilege or anything, and now I'm in this very uh, highly coveted privileged position, may be able to exert change in certain paths, or being part of that effort, I think is very, very, important.
Rewarding, and I agree with you. The gratitude makes us happier and stay focused. Um, Let me ask you the balancing act of your work, how busy you are. You have a young family. How are you balancing that, and what is the suggestion you have for young physicians?
Right. So I think COVID and everything else that's happening in these last few interesting months has shown us the value of our personal life, and how the balance needs to be really a focus of what we do. So what I try to do always is, yes, I have certain goals, and I can probably say, yeah, I'm an ambitious individual because I'm always looking for something new. But you should always have some time for your family, always, no matter what. So either you work hard and just burn the whole hours that you're supposed to dedicate to someone else, but then you focus on your family at least a few hours a day, so you're good and build great memories, because you never know what's going to happen tomorrow. So that's the focus in my end is carpe diem, live every day as this is your last day on this planet. Be grateful, be humble, and try to be happy, and make others happy as well, even though you know that you cannot make everyone happy. But at least if you're happy yourself, maybe you can give that happiness to someone else, so they can resonate with them. And be empathetic, always look around, see where they're coming from. When you shift frames and see what's behind whatever's happening to them, you can really understand and really ease your mind of what's happening, and you really solve a lot of conflicts. So just live your life to the fullest, and remember, a lot of things you're feeling are in your brain. They're not in anyone else's brain. Everything you're feeling is coming from inside of you. So things you cannot control, they're fine, you deal with them. But your own emotions and how you react to things that happen in front of you is all you. So if you have that in mind, you can control a lot of things that otherwise make your life not as pleasant as it could be. So
Wonderfully well said. I'm going to try to summarize it because I think they're golden words. And you mentioned about gratitude. Be thankful, be happy, and try to spread that happiness to your family by giving them time and your love. Um, of course, be ambitious, but don't go becoming too upset about things that are not in your control, because that negative emotion that would be created would actually just harm you or make you discouraged. So just stay focused, be empathetic to other people, because there are millions and millions of people who are below us in terms of status, being health-wise, and resources. So knowing where people are coming from is gonna make a huge difference. These are great words of wisdom. I appreciate it. I'm gonna move on to a little bit lighter side of our topic, which is going to be about, if you were not a physician, or maybe physicians don't exist in this world, what would be your life's ambition or a dream job? if you were not a physician?
If I was not a physician, I would be like an astrophysicist or something related to space. I'm always, I've been a, Star Trek fan, and I love anything about, learning about space and the universe and how these like life forms and everything that is related to anything outside of Earth has been something close to my heart and my passion to learn more. So I wish I could live long enough, and all my family and everyone else that I love also be with me. That's the thing. I don't want to live forever if it's just by myself. But I would love to have the chance to see those things that are really beyond our understanding right now. But I'm sure we, as humanity, hopefully can grow together to understand them better. So that will be probably my passion, like astrophysicist, working with like NASA or SpaceX or any of those companies that are really going to advance the way we understand things beyond this planet. So
Wonderful. I was not wrong in comparing you or making a connection with Elon Musk. Then this is so. My assessment of you was quite right on. Let me ask you about a question of a favorite destination of travel or vacation where, whenever you want to have a moment of peace, you want to go back to that place again. Where is that place in the world?
well, there's so many nice places in this planet, but one that always brings me peace and I feel happy being there is in Cartagena. So Cartagena is a coastal city in Colombia, where that's where my grandparents met and where my mom was born. And I spent wonderful vacations there as a kid. And it's a very relaxing place, a lot of history, but not overwhelming. And listening to the ocean and just being there and feeling that I have a sense of belonging with that place, because that's where you know some of my relatives that I really care about have a happy life there. It brings me to feel happy about the whole thing. So it's a good place for me to visit, and it's really not that difficult. So it's that direct flight from Miami. So I go there often on vacation with family, and we meet there. So it's a very good place for me. Outside of the U.S., in the U.S., I mean, there's many places that I find relaxing, but my house and my couch is perfect. So
Yeah,
yeah,
wonderful. Tell me the name of the place again.
Cartagena. So
Cartagena. Okay.
Cartagena.
My next question is, how do you relax yourself? Uh, Personal wellness has become a major issue these days, COVID or burnout from work. Is there's a way that you try to relax yourself?
Yeah, so spending quality time with family is always important, but I like to, when I can, just walk in a place that is COVID free, that I can actually breathe like air and relax. I try to exercise a little bit every day. I do push-ups and stuff just to keep myself a little bit fit, and I walk the stairs at the hospital all the time. And mentally, I'm all passionate about languages, so I oh, I'm I've been studying Japanese for the last few years, and interestingly enough, at night I just watch Japanese cartoons as part of just to practice Japanese, and I find it entertaining. Kind of brings me back to my childhood to some extent. So I watch anime, but it cannot be lame anime. It has to be something like deep. But I watch a bunch of different episodes whenever I get the chance. I mean, it's not every night, but I try to do at least half an hour, lighten up by listening some, Japanese language and try to understand what they're saying. And that also gives me a little bit of relaxation and disconnect. So, yeah.
Oh, that's a great idea. I've always thought of a way to learn a new language. And this is a great idea, to learn a new languages through their cartoons and their comedy, because I think that makes you happier. And it's culturally, there are many things that are being discussed in comedy that actually comes up. Otherwise, Japanese culture is a closed one, a secret one, and it's hard to understand completely. So, um, if I would to tell you that, Arturo, you have a month of vacation, everything is taken care of, your research projects are going fine, you have no limit on money, You have no limit on any travel restrictions. How are you going to spend that 1 month?
Oh, that's wonderful. That'll be wonderful. I would probably take a cruise that takes me to many places in Europe and Asia. It stops at different ports every day and different experiences, and have the chance to relax, hopefully with family and loved ones.
Very
Um,
nice. Good. I thought always a world tour, but I think that it makes it more easier and possible through the sea because you're not wasting your time in the security of airplanes.
exactly, just sleep and you sleep with the ocean, so it's like perfect. I take the longest I've taken is a week, but I always feel is a great place because everything's taken care of for you, and there's a new port every day, and you learn something new every day too. So yeah.
How do you spend your time with your kids, your family? What is the fun part that you love doing with them?
Just playing, it's just this experience of being a parent is so fulfilling, which you never thought before that. You always, when you have kids, you think your life is perfect anyway, but when you have kids, it really changes the way you see it. So just focusing on the growth, development, and happiness of those tiny individuals in front of you, and just relishing on how, when they say something new, when they come with something interesting, and it's absolutely fulfilling. And I feel that my biggest role in life is being a parent. I mean, hands down. If anything, when I leave this planet, I feel the best thing I can do is to have my kids remember me as a loving parent, no matter what. So, someone who was there for them and help them grow and be whatever they wanted to be, because I feel that that's what I will want for anyone in their life. So I think the only thing we leave in this world is memories, and you don't care about like Nobel prizes or things. What you care about is how your loved ones will remember you, and being a parent is the best thing for me for that.
Wow, very well said. Now, last question that I want to remember us as a conversation which had fun. So, is there a moment of oops, a silly moment that you had with your kids? Maybe you messed up their pancakes or something, and that you think that when that moment comes to your mind, everybody around you bursts out in laughs.
I mean, there's so many of them, but I think just being a parent, and when all of a sudden my daughter just peed on me, and then I tried to put the diaper right away, and then I just put it backwards, and then she just pulled my nose, and then it's like a whole disaster. And I look at her and say, "What the hell was I doing?" It's just like so much fun, and then she just gave me a kiss. I mean, so I always think that just silly moments with your kids are very very special, and being a parent, no one teaches you how to be one. So you just have to do your best. This is the same, I mean, with anything else, but this one doesn't come with a manual. So just, live the best you can and do what you can.
Arturo, that's wonderful. Thank you so much for sharing your candid moments of your life, your journey. It's been a pleasure. And I only hope that you continue to grow and do the good things you're doing for all cancer patients and the humanity that will come after we are gone. So thank you, and hope you have a wonderful time with your family whenever you get a chance.
Thank you so much for having me. And I really enjoy our conversation. I'm looking forward to seeing more of your show and other experiences from other folks. So, because we're going to learn from each other. So
Thank you.